Discover how to easily and quickly calculate the QRS axis on the ECG. Whether you are a medical professional or simply interested in learning more about electrocardiograms, you won't want to miss today's discussion. Let's get started. In electrocardiography, the mean electrical axis of the QRS is a crucial measurement that should be performed for every patient. A normal QRS axis is typically between -30 degrees to 100 degrees. If the axis is more negative than -30 degrees, it's called left axis deviation. If it's more positive than 100 degrees, it's called right axis deviation. The mean electrical axis is determined by the position of the heart and the direction in which the stimulus spreads through the ventricles. For beginner students and professionals in general, the precise calculation of the QRS axis is not as important as answering the following key questions. Is the QRS axis normal? Or is there deviation of the electrical axis? The answer can be obtained simply by inspecting the QRS complex in leads D1 and D2. If the QRS complexes in both leads are positive, the axis should be normal. If the QRS complex is predominantly positive in lead D1 and negative in lead D2, the axis is deviated to the left. If the QRS complex is predominantly negative in lead D1 and positive in lead D2, the axis is deviated to the right, or at least a borderline right axis deviation is present. Very rarely, the QRS will be predominantly negative in both leads D1 and D2. In such rare cases, an extreme right or left axis deviation will be present. In this example, it is possible to observe a tracing of the peripheral leads of the electrocardiogram. The QRS complex is positive in both D1 and D2, indicating that the electrical axis is between 0 degrees and 90 degrees, which is considered normal. It is important to note that the QRS complex is more positive in D2, suggesting a more vertical position of the electrical axis, close to the positive pole of D2. In this other example, the QRS complex appears positive in D1 and is biphasic in D2, with discrete negative predominance, indicating that the electrical axis is between -30 degrees and -90 degrees, which is considered left axis deviation. It is important to note that the QRS complex is almost biphasic in D2, suggesting an exact position more perpendicular to the D2 axis, being close to -30 degrees. In this other example, the QRS complex is biphasic, with slightly negative predominance in D1 and positive in D2, indicating that the electrical axis is between 90 degrees and 150 degrees, which is considered rightward deviation, or at least borderline rightward deviation. It is important to note that the QRS complex is almost biphasic in D1, suggesting an exact position more perpendicular to the D1 axis, being close to 90 degrees, which favors a borderline deviation. This axis is a common finding in young patients. Axis deviation is a common finding on electrocardiograms or ECG, which are used to diagnose various cardiac conditions. Let's take a closer look at the clinical significance of axis deviation. Right axis deviation is seen when the mean QRS axis is 100 deg or more. It may be seen in normal hearts, but it can also indicate right ventricular hypertrophy, which is a serious condition. Right ventricular hypertrophy occurs when the right ventricle becomes enlarged and thickened, which can be due to a number of factors. Right axis deviation can also be caused by myocardial infarction of the lateral wall of the left ventricle, left posterior fascicular block, or chronic lung disease such as emphysema or chronic bronchitis. In some cases, acute pulmonary embolism can cause a sudden shift in the mean QRS axis to the right, but it may not necessarily cause actual right axis deviation. Left axis deviation, on the other hand, is seen when the mean QRS axis is -30 deg or more. It can be seen in patients with left ventricular hypertrophy, left anterior fascicular block, or left bundle branch block. Left ventricular hypertrophy occurs when the left ventricle becomes enlarged and thickened, which can be due to a number of factors. Left axis deviation may also occur in the absence of apparent cardiac disease, and it's not necessarily a sign of significant underlying heart disease. Nevertheless, recognition of right or left axis deviation often provides supportive evidence for other disorders. It's important to note that the limits axis deviation used here are necessarily arbitrary, and different authors may use different criteria. This reflects the fact that no absolute parameters have been established in clinical electrocardiography, and only general criteria can be applied. Finally, in rare cases where all 6 extremity leads show biphasic complexes, which makes it impossible to calculate the mean frontal plane QRS axis, the term indeterminate axis is used. An indeterminate QRS axis may occur as a normal variant or may be seen in a variety of pathologic settings. Thank you for taking the time to learn with us today. Please share this video with your colleagues, subscribe to our channel, and give us a positive rating. We hope to see you in our next lesson.